Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by your friends at Walgreens. We would like to remind you that the Q&A feature is available, so feel free to send in your questions throughout the discussion. Our panel would love to hear from you. And with that, I will turn it over to our moderator who joins us from Drucker School of Management, Ryan Patel.
Welcome, everybody. Hope everyone's doing well. I'm gonna try to make this very interactive. So get your questions as now, because I'm not waiting till the end. If you've got great questions, I'm going to try to interject with them while we're talking to our leaders. And also, we're gonna try to keep the pace up. And we got two different 30-minute sectors, which I'm going to talk about. But first, let me set the stage. May is Mental Health Awareness Month in the U.S., and we're obviously continuing to heighten the awareness around probably the biggest healthcare crisis we've seen in the country today. And I think for me, working together, collaborating, creating solutions is probably the key. And I'm fortunate to be a part of this. When you think about some of the stats that jump out to me, there's national stats showing on average 1 in 5 will experience a mental health issue in any given year. And that was before the pandemic. So for me, there's another number the National Institute of Mental Health estimates almost 50% of adolescents have had a mental health disorder at some point in their lives just last year alone, and nearly 40% of those who took an online mental health screening through the MHA in 2022 were under 18. So what does that mean? That means we have a lot of place to improve if we want to make a larger impact. And so today we're going to cover both of these important topics: workplace mental health and the youth space, which is the second half of the hour with our panel of experts. So let's bring on the experts and let's have a great interactive time. So joining me for the first 30 minutes as they come onto the screen, Holly May, EVP and Global Chief Human Resource Officer at Walgreens Boots Alliance; Stephen Sokoler, founder and CEO of Journey; and Kana Enomoto, MHA board member and director of brain health at McKinsey Health Institute. Welcome, everybody. How are you all doing?
Hi, great to be here.
Great.
Great.
Thank you, Ryan.
Thank you, Kana. Stephen?
I'm excited. I know it's supposed to be fast paced, so I'm ready.
So to the audience, so they don't know where I'm going. They don't know. This is not really scripted, but I want it to be organic. I want it to be meaningful, that you can take away certain things. And Holly, I'm going to put you on the spot right now. Right, there's a greater focus. I'm not even going to wait. When employers have to do more to support health and well-being of their employees, and it's clear that's the case over the last few years. So I'm going to put you on the spot here. If we're organizations that they don't know where to start, because it is a daunting task, what is the first step, or maybe 1 or 2 steps that you think is important that they can do right now when they're done listening to us to create a culture of well-being?
Well, first, I would say that our team member vision at Walgreens is to care for our employees as whole people. And for us, that means body, mind, and spirit. So with that, as we look at mental health in the workplace, we divide that up into 2 different categories. At least this is how I think about it.
Yeah.
The first is how we train our leaders. Our leaders are creating the environment, the culture within our organization. They're they're the ones who make sure it's inclusive, and they really drive the employee experience every day. So the first part of that is, how are we making sure our leaders feel prepared? The second part of this, I would say, is related to the programming, the tools, the resources. And what I would say to other organizations, the most important tip in my mind is listen to your people. I feel very strongly there is not a one-size-fits-all approach for every organization, but listen, find out what your employees need. Find out how they want that delivered. And for Walgreens, what that meant was introducing a trio of solutions and platforms in the mental health space to help deliver care to our team members. We launched that actually last May during Mental Health Awareness Month, and it's called Be Well Connected. So that involved an EAP, it involved Journey Live, and I know you're going to be hearing from Stephen soon, as well as IndieFlix. So really giving that expansive set of options and delivering the care and the support in different ways.
So, I mean, I appreciate that. And for the audience members, I'm going to feel prepared. So anything that you can do to be prepared and listen to the people. And as Holly mentioned, it doesn't necessarily have to be so complicated. You know, take that feedback, right, Holly, and to be able to incorporate that.
Right.
You know, while I started there and we're thinking about what you can start, and that just tells me, you know, I'm excited about this conversation because it's evolved. We're all here. We're openly talking about it, kind of, you know, so there has been an evolution of the workplace in mental health over the years. However, I'm going to stop it here because I need to understand, how would you characterize the state of mental health in America today? Because we may get caught up of we're making progress, and it's great that we are, but where are we really at as of today here?
That's like a mental health game show. You know, I mean, Ryan, it's a great question. And, you know, I think people are on this webinar because they know this is becoming an issue of crisis proportions, right? I mean, it's 1 out of 4 Americans in any given year is experiencing a mental or substance use disorder. During COVID, we saw up to 46% of Americans saying, I'm experiencing symptoms of depression and anxiety. And it was worse in communities of color, worse for LGBTQ+, worse in certain parts of the country. And so we know that, you know, the past few years has been extremely stressful. And the opioid crisis has gotten worse. We saw a 50% increase in adolescent girls showing up to emergency departments with suicidal ideation. So that is the bad news. The good news is we've never seen more mobilization around trying to tackle these issues than we have seen in the last couple of years. And so there's just been, you know, money coming from the federal government. There's been state action. There's been, you know, in our surveys, 80% of employers saying, you know, we really want to refine our mental health offerings, and we are doing something about it. We're either, you know, maintaining or growing our portfolio. So the state of mental health, not great. The promise of mental health, very good.
So real quick then, what's the greatest needs then? I mean, you kind of mentioned where we're going. Can highlight a couple things that you feel like, hey, this is the things that more resources or things that we need to be talking about and paying attention to?
I think one of the biggest crises we have is, or within the crisis is, we need to move upstream. And this is why it's so great to talk to employers, because there's, you know, 1 out of 4 employees is experiencing burnout. There's an opportunity to intervene in that, you know, what Holly's saying, with those managers, with the work, with the toxic workplace culture, with the sustainable workload, et cetera. Then there's also moving upstream, early childhood into schools, you know, get the problems before they start. And then fundamentally access, right? And I think that's what we hear a lot from employers saying, we want our employees to have access to care when they need it. And that is a challenge.
Well, that's a great segue to Stephen. Stephen, you probably know I'm coming now because I heard what Kana mentioned. You know, I want you, and those who don't know, Journey is a platform that offers kind of a wide range of tools and resources, and they really partner with employers. So I'm going to, from your experience, what are some of the things that you've seen that you can share, that trends you're seeing that employers are asking for, things that they're interested in, that you, not so much that we would know, but like that was interesting that we wouldn't know that they were interested in? I don't know if you can hit a couple of those points to give us a little more color.
Sure. Are you looking more for employers or employees?
Both. So let's go employers first, because Kana mentioned it. And then you already jumped my second part already. I was going to get you on the employee question, but we can go to the employers, and then I'll pretend to ask you the employee question afterwards.
One step ahead, my friend.
Yeah.
No, I think the thing is, it's an aha, but it isn't an aha, which is that employers want resources that meet employees where they are. It sounds simple, but it's actually really hard, especially when you're working with big organizations that have a really diverse range of employee types and different people. And so how do we make sure that, whether it's, this is my first job, right, and I'm working at a big organization, or I'm working at a small nonprofit, or I've been at the organization for 30 or 40 years, how can I find myself in these offerings, and how can I hear about them, and how can I feel like it's for me, not some old HR resource that nobody really cares about? And so continuing to say, how do we make sure that we're finding ways to speak to people in a way where they say, wow, this is for me.
Mhm.
And what about the employee side to a certain degree? What tips?
You hear employees saying a lot. It's actually kind of, I think, challenging to be on the HR side, because employees are coming to leaders and saying, we're starving, right? And HR is saying, but we're offering you this whole buffet of benefits, right? You have everything available to you, and employees don't feel like it, right? Because they don't know about it, or if they know about it, they don't know how to connect to it. And so employees are just saying help. They don't, to be honest, they don't really know exactly what they need, except for when they do, right?
Yeah.
I'm entering parenthood and I know what I need. But when we're talking about mental health, there's a lot of just, I need help and I don't know where to start.
And that's a great point. You know, Holly, those who don't know, you and I have crossed paths before. And the reason why I'm a part of this is because we've had conversations in the past off camera about the stigma of treatment and care and just your journey. And obviously I connected to you just because what we talked about, that open dialogue, which we need leaders like you, like Stephen just mentioned, of HR being able to do more and to break down the barrier. But it's just not you, right? It's all of us and all leaders across the thing. So how do we do a better job of breaking that stigma barrier? So for people who are seeking treatment or care, they don't know, what are some tips, things that you think in the workplace that leaders can encourage this open dialogue? Because it's not easy actually for those who doesn't come naturally, or they haven't gone through a conversation that you and I have had in the past.
And you know my catchphrase, I like to use the term being unapologetically human. And we really want to encourage at Walgreens that people can show up every day as the wonderful, authentic human they are. And that means, you know, expanding beyond professional support, you know, really that line between the personal and the professional being forever blurred, and making sure that our leaders are meeting the needs of our employees to ensure that they can perform at their best at work. And it is a business imperative. So for us, when at the beginning, when I was talking about, you know, a big part of this is preparing your leaders. If you want your employees to open up, to explain to their managers what they need to be successful, you need to create an environment of trust. And that's up to our leaders to deliver. And a big part of doing that is embracing vulnerability. So this goes back to the unapologetically human side, because if they're opening up about themselves, you know, if they got into work late because perhaps their toddler threw up on them and they're honest about that, you know, that breaks down a barrier. That helps your employees say, you know what, I had a challenge today. You know what might help me? A bit more flexibility. Maybe if, you know, my hours shifted a little bit. So it's helping the manager deliver on what that person individually needs, and in doing so, enabling that individual to perform at their best. And you only do that by breaking down the barrier first yourself.
And Holly's too humble, everybody. But if you go research her, Google her, see, there's a story that she puts out there. You lead by example. Should you not do it, people don't know. And I don't want to take over the time of, I know I don't want to embarrass Holly, but it you know, every time there's a story that she's doing that others can follow. And so Holly, kudos to you. To lead by example at all levels is important. And you know, I got a question here. So I told the audience, you send questions, I'm going to ask them. I'm going to put it in there. Kana, you're going to take a question here. I'm going to read it. You know, well, first off, they said thank you. So thanks for that. How do you feel about hyphenation between mental health issues and cognitive issues? It's a fine line distinction, mostly in semantics. How would you address that?
You know, cognitive issues and mental health issues both occur along a continuum, right? So we have, you know, from good health to poor health, or moderate, you know, impairment to severe impairment. And so I think, you know, there's increasing conversation about like neurodiversity in the workplace. And, you know, are we being inclusive for our neurodiverse colleagues? Are there ways to incorporate and adjust our work styles, our workplaces to be inclusive? And in that sense, I think of that as a subset of kind of the broader mental health psychiatric umbrella. At the same time, we're looking at how can we create more inclusivity for older adults as they are trying to, many older adults say they want to be employed, but they aren't employed. People over the age of 65, and being engaged, having purpose, all of those are really important to maintaining your cognitive health. And then, then you have on the other end, the SMI IDD population, which I think that's a little bit more complex when it comes to how to have sustainable work for that.
So thank you for answering that, Kana. Shout out to Tammy Ellison who asked that question. Thank you for that. And Stephen, there's another question. Now there's a question just for you. I keep the questions coming, and if you want to target it toward our leaders here, I'm going to continue to do it. So Stephen, here's the question. In the context of mental health and wellness, what role do you believe technology and digital solutions play in improving access, support, and overall outcomes for individuals? How can we ensure that these advancements in technology are equitable and inclusive? What a great question, Stephen.
Yeah, there's a lot there. So I'll start at the beginning, and then I'll turn some over to my esteemed panelists here. But I think technology is a absolutely amazing tool to be able to supplement and complement the work that we're doing. So there's a lot of ways that technology can provide access. It can provide access to different therapists or teachers or coaches or communities that one might not have availability, have access to otherwise. With obviously the rise of AI being something that's probably on a bunch of people's minds, it creates some interesting questions about what will technology be able to do in terms of providing us with companionship and curing some of the loneliness. I'm sure we've all seen, the Surgeon General's studies on loneliness, right? And so I think technology is an amazing tool, and it is not a replacement for human beings when it comes to providing mental health support.
What, Holly, technology is it's hard to implement at times, right? To get everyone to embrace it, right? I know you all have in this journey for a very long time in this space. Any struggles or obstacles that you think you faced that you've made you better, or things that, or people, leaders that are listening to this, it's great that you have the solution, but it really takes the implementation to make it work. Any ideas, advice that you would have that you've come through your learnings around including that?
Well, I think it was very well said by Stephen. There is no substitute for human connection and creating an environment of inclusion. But I also believe, and I think this is especially relevant to younger generations, that community and connection can be created online. It can be created through the tools that we use to connect. And in fact, certain generations feel more comfortable starting relationships, building friendships online. So this is about, as Stephen, said, meeting people where they are, making sure we understand how they best connect, how they best access services, and then delivering on that.
No, that well said. Kinda, was there something you want? I mean, not going to put you on the spot. Was there something you wanted to add to that, or to that? Like, I see you nodding, so I think the answer is yes.
Yeah, I just also just put something in the chat. We recently published a study that went across 26 countries, 42,000 people, asking different generations how they felt about technology, how they were accessing digital mental health resources, and then their use of social media. And other things. And what we found was very interesting. Sort of about a third of people felt that technology and social media were helpful tools to enhancing their mental health. And that was sort of across generations. But as you go to the younger generations, you see that there's more mixed feelings, right? So about almost 30% of Gen Zers said that social media is not helpful to my mental health. And then I would say more Gen Zers were said, I want in-person mental health care. So, Gen Xers, baby boomers actually really like digital mental health tools. And young people in our research said it doesn't quite meet snuff.
Do you go ahead, Stephen?
I was going to say, I love hearing that. I'm excited to check out the study. I think it's important to understand that technology is a tool. It's not the tool, right? It's not the replacement and that's everything. And if you spent your life growing up staring at your phone instead of interacting with people, that can be really challenging, right? So how do we teach people good technological or technology habits, right? Good digital habits, so that they can use it in the most appropriate way that really suits them.
I love this conversation because I didn't mean it to start it this way, but I mean, hopefully you're hearing that you see the habits, but also the leadership implementation, right? And then how to use it. There's like, I mean, there's multiple steps, but there's 3 buckets that each of you touched to make sure that this process actually makes an impact. So when I think about that process, and real quick, I mean, if you can give me, we got about 8 minutes left and we still got a few more questions. When I think about, I just come top of mind, I know we're positive here, but like, obviously this is not occurring for some of these managers. It's just clear. And I'm looking to them, or I'm looking for the people in the audience who are leaders, who care for this. How can they help those to be not better educated, but to influence this conversation? Because we all know if you just say, hey, this is the right thing to do, it doesn't really occur. So Holly, is there, you're smiling because I think, is there something we could tell them?
I'm smiling because I'm about to do a pretty shameless plug, but
okay. Go ahead.
We're really proud of our partnership with Mental Health America that we've had over 7 years now. And last year, we actually rolled out a toolkit for employers, which is about mental health in the workplace. And it gives a lot of tips and tools and resources, just starting from how do you even build a strategy to tips for managers about when you're engaging in conversations with your employees about mental health. How do you handle that? I know we recently had a courageous conversation here at Walgreens as part of Mental Health Awareness Month. And, what we talked a lot about is, managers are afraid to have these conversations. I think any of us would be. We don't know what's coming. We don't know if we're going to have the right answers, but you don't have to have the right answers. What you have to do is approach from a place, not imposing judgment, approach from a place of care and understanding. And in doing so, and engaging your HR partners, of course, where needed, you're going to provide the employee with what they need. So I think, reaccessing this toolkit, which is still up on the website at mha-national.org, I would definitely point people to that if you have concerns or you want to approach things differently at your organization.
And I've actually gone through it last year, and it is a really great resource. It's free. So those are the leaders that listen, it's free. Go ahead and do it. Holly, there was a quick question that came online, if you don't mind trying to quickly answer it. Are there any commonalities that are leading to employee burnout, and how can these proactively addressed by employers rather than reactively?
I
know that's a tough question.
Yeah. I'll give it my best shot. I think, post-pandemic, this is something we've been hearing about more and more. I think, there are a lot of stressors out there. People are dealing with a variety of different issues personally and professionally that they're trying to tackle. I think what we have looked to champion here is creating an environment where we can be open. We champion flexibility. We've really embraced a leader-led hybrid model to ensure we can deliver customized solutions by team member, that there's not one guideline or one way of doing things. And, I talk to my peers externally that I believe works. I think it's about, making sure you're understanding individual needs, and as much as you can as an organization, still prioritizing results and getting the work done, that you're accommodating those individuals.
Oh, well said. And Stephen, real quick, before we go to Ryan's lightning round, I'll explain it to the audience what that is. But Stephen, another quick question came in. See, I'm trying to get everyone's questions in here when we can. How can organizations measure the effectiveness of mental health programs and interventions?
Great question. I love that question. Really important question, because oftentimes the HR and people leaders understand it, but then when they're talking to executives, not all executives are as enlightened as Holly, and sometimes you have to make the business case. Sorry, Holly, it was too good. The truth is,
Stephen, it's true though. I mean, it's clear,
true.
right?
It is true. It is true. No, Holly is one of the best people leaders I've had the pleasure of working with, and so you know, it's really important to be able to look at things that can be taken up to the C-suite to say there is a business case to be made for this. So we look at engagement, and not just how many people are using it, but how can we tie that back to actual measurable results, whether that's clinical studies that we've done with Humana or others, or being able to say, hey, based on the best available published resources, right? So Kana and her team, and obviously there's a lot of other great organizations who are putting out articles and studies on the impact that mental health support can have for employees in reducing burnout and turnover and absenteeism and healthcare costs. So being able to make that case. So I'd say engagement. And then of course, if you can do something around claims data, becomes a little bit more tricky, being able to make that case to say, hey, when we're supporting our employees upstream, when we're taking care of them before they have an issue, they actually don't hit our medical plan, right? So it makes sense, but being able to make the financial cases is really important.
Yeah, perfect. Thanks, Connor, for throwing the toolkit in there for those who are bearing on it. The link's in there. So we're gonna play Ryan's lightning round. This thing has followed me everywhere I hosted these major sessions since I've been doing since Davos. So it's one word, one sentence. To the audience, I'm asking the leaders here to give me one word, one sentence to something I'm about to ask them, which they have no idea what I'm about to ask them. So Connor, you're gonna go first. I at least give you a heads up that I'm coming to you first, and we're gonna play two rounds. So one word, one or sentence. All right, you all ready?
As we'll ever be.
Yeah. All right, Connor, I'm gonna ask you first. What is one leadership characteristic that is a must when it comes to a leader dealing with mental health in the workplace? Something that a leader should have when trying to build a program or just to be able to address this.
Commitment, right? Personal commitment, and emotional flexibility.
I love that. Stephen?
I would say authenticity and compassion.
Holly?
Understanding and empathy.
I love those. And here's to take us home with for this first 30 minutes. You know, for me, I think the future of mental health in the workplace is blank. Well, I hit the desk so hard that I was so excited. My bad. The future of mental health in the workplace is, Kana, I'm coming right back to you.
I think in the future, the mental health in the workplace will be evidence-driven, portfolio approach that takes into consideration a holistic definition of health, which is mental, physical, spiritual, and social.
Stephen?
I'm going to say bright. I think that companies have never been more concerned about the mental health of their employees. We spend so much time working. There is such a huge opportunity to improve what we're doing and the lives that people are living through the workplace. So I'm excited and optimistic about the future.
And Holly.
I am going to embrace Stephen's optimism. Yeah. I'm going to say prioritized and customized.
I was sure hoping that this was going to end on a positive note because I have no idea where we were going to go. But I think that for the 30 minutes, I think I appreciate you all. You know, let's jump into the next 30 minutes. We're going to turn the discussion to the youth mental health, which, as I mentioned from the beginning of the session, teen adolescent population that has arguably been impacted by most of this rise into mental health concerns over the recent years. There's a stat here, National Institute of Mental Health estimates 50% of those in this age group, as Kana mentioned earlier, mental health issue. So I get to have Kelly Davis join me, Associate Vice President of the Peer and Youth Advocacy at Mental Health America. Kelly, welcome, and Kana, thank you for joining us in your first 30 minutes. Kelly, welcome to the show, I guess. This is a game show. Welcome.
Thank you. Excited to be here.
Well, you don't have a choice because I'm coming right to you. Welcome to the first. You know, you were just hearing the first 30 minutes about the workplace, but you know, I think you probably have an inkling that I'm going to come to you and ask you because I want to know the current state. Right? There's positivity. There's obviously the last few years, but like for me, like before we even can start that conversation, I would like to know what you're seeing, what the current state is, and maybe compare it to the backdrop of what's happening in the US as a whole.
Yeah, I mean, I would say the current state of youth mental health is very concerning. Someone mentioned earlier, report from the Surgeon General. The Surgeon General issued an advisory on youth mental health. The American Academy of Pediatrics declared a state of emergency on youth mental health. What we've seen in the past few years is just really large increases in thoughts of suicide, depression, anxiety. But I think what is especially important in this conversation about young people is that the COVID pandemic did not cause or suddenly start this increase in youth mental health. From 2007 to 2017, there was a 56% increase in suicide deaths among young people. The COVID pandemic certainly exacerbated youth mental health and introduced a lot of other issues, some of which we really don't know how they will play out. But this is a continuation of a longer term trend for youth and young adults.
So Kelly, let me real quickly and come right back to you. And I thank everyone for the Q&A for the first 30 minutes. We won't be addressing the workplace, but now we're going to be addressing this next topic, as we mentioned, in the youth mental health. So keep those questions coming. And guess what, Kelly? Got a question right now, real quickly, right back to you. So real quick, in terms of resource allocations, this is the question. What are some key areas required increased attention and investment to better meet the growing need for youth mental resources, is what the question was from the audience.
Yeah, that's a great question. And I think I want to echo something that Kana said earlier, which is the best strategy is prevention and promotion. I think historically and currently, a lot of young people's introductions to mental health services is through the emergency department or through a crisis scenario. So I think we really have to, and we've seen this in the past few years with a lot of investment at the federal and state levels in mental health education in schools, social emotional learning. So I think we want to really focus on education, peer-to-peer models. A lot of the challenges and solutions that aren't necessarily mental health service based, but about transforming community and culture.
So with that, you're mentioning that, and it makes me think of a question. Now, Stephen, I'll come to you. This because the question's come to me, and I see you in my screen. How does it differ? Because I think the first thing pops up is you've got the youth, but how does it differ from other generations, right? When you think about that work, other ways that you can support that well-being. Is there some characteristics that are similar or different that we can learn from other generations?
Yeah, our area of expertise is certainly not youth mental health, but it is how do we make sure, we have more generations in the workforce now than we've ever had before, and how do we make sure that we're, as I've said a few times, and as Holly said, meeting people where they are, right? The tools, the resources, everything looks very different depending on your life stage. And so it's something that we keep very, very top of mind in saying, how do we find things that is really going to sing for people, right? If this is your first experience in the corporate world, or you've been there for 30 years, or you're about to give birth, or you're in menopause, right? These are all very different life stages. How do we make sure we're supporting you?
Yeah, and go ahead, Kelly.
I jump
go,
in?
Go,
yes, I'm jumping in.
Yeah. Yes,
okay.
Love it.
So one of the things that I think is also really important is when we talk about youth and young adult mental health, families have to be are essential in that conversation, and the impact that missed days of work, the youth mental health system, because we don't emphasize promotion and mental health services in schools, also has a really significant financial and just resource and logistical impact on family members who are lucky enough to be able to access mental health services.
So that's a great point. And another question that came up that I'm going to bring in from that was from the audience. And Holly, I'm coming to you because I think it ties into this, with what you do at Walgreens. How does youth mental health fit in with the investments you've made to support your employees? And that came from the audience as well.
Well, I can give a great example, and this is related to the partnership that we've had with Stephen and his organization, Journey Live. As we've been listening to the needs of our workforce, Journey has been such a great partner in creating customized content for us. I mean, one example being, creating resources for pharmacists that has been helpful. But the example I was going to give is a class that was designed for parents of children with special needs. So this goes back, we were talking about neurodiversity earlier and how that intersects with mental illness. And I think, delivering for our workforce, delivering for the parents out there, for the relatives, for the caregivers on how best, to support their families through this crisis. And I know Journey's been a great partner in that.
I saw Stephen. Kudos to you, Stephen, and the team. I don't know if you want to add anything on top of that.
I think just one thing, which is way back when we started this conversation, whatever it was, 37 minutes ago, Holly shared that one of her key insights is listening to the needs of the employees, right? And I think that that's so simple yet so profound, right? And people being able to support them and then listening and hearing what they need. And then we as an organization, obviously, listening to what we're hearing from both HR leaders and from employees and saying, what can we do to support not only, and Kelly touched on this, not only the employee, but also their family and also their community. I think the community part is really something that is overlooked. Like for us, we allow employees to give unlimited access to any loved one, not simply dependents, but hey, you have a next door neighbor and you live in a small community and they just lost their significant other. That's going to really impact not just them, but also you. So how can we wrap our arms around them and support them? So I think there's a lot of work that we can do in communities to kind of, rising tide raises all ships, help not just the employee, but also everyone around them.
And right back to you, Holly, when I think about that, not everyone's doing that. I think that might be the future. I mean, I'm just saying, to me, when you think about community, we say these words and you really have to implement and put a lot of resources to it, which I don't think many are. And I think that's the future, right? I think all three of you are mentioning that this is something that is. Do you feel like, how would organizations do a better job to ensuring that focus stays there, right? Because you can say the word community, but not really stay the course. And I think that is the future. Do you feel like that's the future of how you can get better and evolve in this space to better way to include the community? Because it is not easy, but it's a must, and it's only going to get deeper, right?
Right. This is core to our purpose at Walgreens, which is more joyful lives through better health. And we view health as body, mind, and spirit. And this is not just for our employees who very much are prioritized. This is about our customers, our patients, and the communities we serve. And this is why we've, in our partnership with MHA, we're going to be rolling out in August a back to school toolkit. And this is really key. And we found ourselves as great partners for this, as we have had in place what we call the Walgreens Expressions platform since 2009, which is a program. It's actually a challenge that reaches out to our communities. We actually have a network of about 800 schools across the US and Puerto Rico, where we are engaging students and allowing them to express the challenges in their lives through the arts, through the creative arts. And we saw this as a great fit with MHA to really support their work in the launch of this next back to school toolkit. I know they already have one out on their website, but with this newly enhanced toolkit that will be rolling out this year, we're excited to broaden the impact of that through our network.
And I think just to the audience, I mean, the thing here is you got to continue to find ways within organizations to do more, right? And that's what you just mentioned, how you keep putting toolkits and the other ways that you can make an impact, that it's not just static, a static aspect, that you continue to be where your community is supposed to be. There's not a one size fit all, as you mentioned earlier. I don't want that point to not be heightened to this audience, is that you can't stay still, can't stay static, and you got to continue, especially when it comes to the community, it's about the experience. So that's well said, Holly. And Kelly, on top of that, there was a question that came up which is related, and I want to make sure I don't say her name wrong, but I apologize. Anosha Sanjani, she had asked the question, what role does peer support play in addressing youth mental health, and how can peer mentoring programs be effectively implemented? It's a longer question, but what role should we talk about social media and technology companies play in promoting positive mental health for young people, which we kind of talked about earlier, but I would love to get your thought process because you're closer to it than most of us, and how it can potentially harm the mitigation.
Yes, I feel like there was like 5 questions. I'm gonna
Yeah, so let's
I'm gonna, I'm gonna back up a little
start where
bit.
you want to start. We can start where peer
Okay.
support playing and addressing, and we can all, we all, Stephen and Holly can jump in as well, so you don't feel like we got to answer all 5 here.
Oh yeah. So that is the thing that I care most about in the world. And I think it is increasingly accepted that peer support has to be an essential part of our strategy to address mental health. Not only because we just don't have the clinical workforce, and that's going to take a lot of time and resources to expand, but also because people turn to people in their communities. Young people talk to their friends. Their friends are often the first people to notice if they're struggling. And there is a growing evidence base from global mental health and increasingly used in the US around this idea of community initiated care. And that's that lay people can be trained similarly to clinicians and get the same outcomes, particularly in addressing depression. So I think,
Yeah.
okay.
So I was going to say, pushing you a little bit more further, because it's part of the question, how can the mentoring programs, because I think that's what you're leading to, wherever that looks like, be more effectively implemented? How can they be better?
Yeah, I mean, it's really about going and embedding resources into wherever young people spend their time, right? Because peer is kind of a self-defined concept. So
let's use the example, social media technologies. Yeah, I'm helping you get to all these questions all in one aspect.
Amazingly, okay, through social media. So social media, I think, is incredibly important. Kana mentioned that different young people experience social media differently. I will say in particular for LGBT youth, especially who are kind of early on in discovering their identity, really benefit from connecting in online spaces to other young people. Especially, for young people, there's a commonly used phrase of one supportive adult. Like the power of having somebody slightly older than you who's been there is really important. And there's a growing number of tech-based resources. One of them was invested in by one of our partners, Hope Lab. It's IMI, and it's all content by and for LGBT youth to help them explore their identities. So there's ways to use the power of technology while removing it from some of the more harmful effects of things like that social media can have on vulnerable young people.
And this is a hard conversation to have in general, because there is that social media aspect back and forth. Stephen, I know I'd love for you to jump in and add a little more color to it based on what we had the first 30 minutes.
Yeah, when we first started, when Journey started in 2015, right before the pandemic, before mental health was really as prominent as it is now, not that it shouldn't have been, everything we did was focused on community. And that remains one of our core pillars, because what we found is that having support from a friend, from a colleague, being able to talk to somebody who's like you, it doesn't have to be in a clinical setting with a therapist, can be extremely helpful. The studies support this. One other thing that we're currently doing, we're working with a partner, Lululemon, to train their team members on essentially mental health first aid. It's a mental health certification program that we built that focuses on diversity and inclusivity and what to look for and how to support others proactively, right? And so I think that there's a lot that, again, I keep going back to organizations because kind of a one-trick pony, it's the only thing I know. A lot of things that organizations can do to be able to support their employees to provide exactly what Kelly was talking about, that worship, that friendship, that companionship. It doesn't have to be necessarily top down.
Can you share, if you don't mind, like it's not a one-trick pony because you're talking to the youth when you're talking about Lululemon to people coming in. Is there something that you can share, a strategy that you train that the audience can say, hey, this is something I could do for somebody else? Is there something that you can share to approach a conversation, or like for me, I'm an introvert by nature, so it's like to be able, when I was younger, I'm not talking to anybody about anything. So there's something that you train and teach that we can kind of hear that you're all working on. It doesn't have to be with Lululemon, but just something to the youth perspective, Stephen.
I think that the 5-second thing that I can give you is when you're asking somebody how they are, is to actually ask them and to give space to listen and to feel into the moment, and not, hey, how are you, Ryan? I'm great. How are you? Oh, I'm great. Actually, are you? Are you? Because maybe you're not great in that moment. And maybe just having a little space to be able to share that and say, I'm really struggling. My grandmother's not doing well. Oh, I was there too at one point, like having that actual human connection. And oftentimes we move so fast from one thing to the next.
Yeah.
Just slow down. Again, simple, but can be really profound. Things like that can really make a huge difference in someone's life, to just give them that pause and say, okay, I'm not alone.
And it's well said. And Holly, you may not know, but I'm coming to you on this because I know you do this. I've heard stories from your team, from you, about families. Like I probably know a lot more about families, about Walgreens and how you support of some other folks. How do you slow down? How do you slow down when it comes to families? Because yes, you're dealing with the employee, but you actually have to know what's going on in the family's lives of if it's a kid that's sick, or I need some time off, which you and I've heard the stories that what you've done, but I know it's not natural for everybody, and you do have to make sure that what Steven's mentioning for those listening is being authentic and genuine, and behind that, Holly, what are some tips or things or guide that you would share those who want to be better at this?
Yeah, I think this goes to the point I made earlier, and our employee vision about supporting and caring for the whole person. You're not just supporting the professional in their role on your team for them to perform at their best. You have to think about also what's happening outside of the workplace. And I think Stephen, gave a great example there about asking somebody, no, how are you really? Well, if you expect for them to give you a real answer, you've better been, opening the door to vulnerability yourself and saying, I have something going on at home, or, today wasn't my best day. I screw up sometimes, because you have to role model the behavior you expect of your employees. And if you're not, and you're showing up and saying you're perfect every day, they're watching you, and you are not, providing them with permission to show up, as their authentic selves. So I think, that this is about building a place of trust, a place where, your employees feel comfortable being open with you. And, that trust is critical.
If I can build off of the kind of asking authentic questions, modeling, vulnerability, I think the last piece that is applicable everywhere and probably the most stressful for people is what happens when someone shares with you. Because the gut instinct for so many of us is we want to help by fixing this person's problem. And that is like one of the quickest ways for someone who's been carrying around all of this stuff with no one to talk to shut down. Because as the supporter, we can often interpret people disclosing as like, fix my problem, but most people just want someone to listen and affirm that what they're going through is hard.
Wow. I mean, I wasn't planning to share anything like this, but I'm going to share it anyway. But like, this goes to with your spouse, with your kids too, right? Because your natural reaction is to do what? Let me fix it for you. And I know for me, it's been, you do that sometimes it's easier to do in the workplace than it is at your home. And, we were talking about community, to the audience. You have your workplace, you have your own families too, and that's a great place to actually start if you don't know how to start to do it. So Kelly, I love that you brought that up, because it is easy for many people to say, there's natural reactions to help, but if you just listen, that's what they want to hear, and then you can always try to help, and it's not a negative. And Stephen, I know you want to jump into that as well.
Yeah, going down the personal route, when I first started doing therapy, one of the things that was like mind-blowing to me was I would share something with my therapist and he would literally say, that sounds really normal. And it was like, oh my God, that is normal. Like, and it was like this weight had been lifted off my shoulders. And I would tell my wife this, like, it would be this thing that, if you go to your parents, and to your point, Ryan, they give you advice, or your boss, or your friends, right? The ones who definitely shouldn't be giving you advice. Let me tell you, but hearing like, that actually sounds like pretty normal. And all of a sudden you're like,
No.
wow. So for me, those were really powerful moments.
No, and I would actually say, going back to the point that was made before, something that my husband and I actually started doing is when he comes to me and he wants to talk about something going on in his life, I'll say, now, do you want me to brainstorm with you on a solution, or are you looking for an ear, somebody to commiserate with, or you just need to vent? And I think that's been really, really helpful.
Why didn't you tell me this 5 years ago, Holly? I figured that out just a couple years ago. It would have saved my time. My wife, that's what I do now. I know maybe that's where we're on the same wavelength, but where were you 5 years ago? Could have saved me. So she's probably
I
laughing
wish
right now,
I knew this 5 years ago as well. This is new for us.
But and it's interesting because when you do say that, right, it automatically takes the barriers down. And it makes the other person kind of go, okay, what is it that I want from you? And that's okay. I think that at the end of the day, that's what you're trying to get to, is that at least the other person's asking, like, is it, do you want me to listen, or do you want me to say something? And then you have to make sure you don't say anything if it's just listening to that degree, to build that trust to it. So we've got 8 minutes left. So I'm gonna come back to you. I mean, Kelly, when you hear these conversations that are going on, there was a question that came up about personal experiences, which I'm not, we kind of did share each of our personal experiences, so I'm not going to go around that aspect. But when you think about motivation for the youth, and what is it that you feel like could better motivate mental health in that space with the people that you're speaking to, that you're seeing, that maybe like a Stephen, Holly, myself, can go influence those that are not necessarily knowing that they can touch youth mental health, because it is an indirect influence at the same time too.
Yeah. So I think I guess there's a few different answers. I think the one is a lot of times adults don't take young people seriously and dismiss all of their problems. So to not dismiss young people who are struggling, as like, I think the further away you get, the more you're like, I didn't know anything back then, and it all works out. And it does not feel that way when you're a teenager. So I think really appreciating the complexity of emotions that teenagers and young people face. Yeah.
Kelly, can I add, can I also say that it'd be even younger than teenagers, because these kids this age are so much smarter. Yes, you can quote me. They're so much smarter because of the access, the technology. I just think that they're smarter. Do you feel like that goes down to even a younger age as well, that we need to be paying attention more and be opening and listening more toward the younger age?
Oh, definitely. And I think K through 12 mental health education, I mean, right, you're talking about different things to a 5-year-old, right, than you would to a 12-year-old. But I'm a person with lived experience. I had my first suicide attempt when I was 10, and I had no language to describe what was happening inside me. And I think that's happening for a lot of young people, is that they have these big feelings and no one has ever given them any words to use. So I think noticing that, not dismissing that even younger children are really struggling and have to adapt to the years that they lost to the pandemic. So yeah, it's definitely younger. Half of all mental health conditions start to develop before 14. So yes, before folks are teens, they're really struggling with this stuff too, and often don't have any language to share with anyone.
And Kelly, I appreciate you sharing your experience and your personal experience, but because it's meaningful to me, I wrote down words to use, because that doesn't necessarily come to mind to those that are struggling how to explain it, or they may not want to share that because we don't know that that's what they have. So appreciate you hitting that point, because it'll stick with me, what that means. Hopefully it does with the audience as well. So on a lot, we got 5 minutes. We're going to play Ryan's lightning round. And Kelly, I won't go to you first because we've got experienced people in the room about playing Ryan's lightning round on this first section. When I think, what is the first thing that comes to mind, word or sentence, when I say mental health? Holly, I'm going to come to you first, then Stephen, then Kelly. First word, when I just first thing, if we were just sitting having coffee and we just said mental health, what is the first thing that pops up into your mind? Holly?
Takes many forms.
Stephen?
I have two. I would say important and misunderstood.
Kelly?
I would say movement.
I mean, to the audience, you see these three answers? Like, I asked for a short thing and there's so much depth in each of those things. And if you got to see their personalities and leadership styles, there's something meaningful behind that. And again, I know I can't see the head nods from the audience, but I'm pretty sure that that's what they're doing to that degree. And then I love those answers. It really does mean, like, seeing each of you, what that means to you. And Kelly, I'll come to you first. Youth mental health in the future will be, so I'll repeat it again. Youth mental health in the future will be
Youth driven.
Stephen?
Better.
Holly?
More understood.
So we're about to come wrapping up, and I want to thank all of you, the leaders that are on the panel with me, for your courage and bravery to a certain degree, because you didn't know what I was going to ask you. And those who do know me, that I encourage these kind of conversations to be healthy, to be not spontaneous, but to be meaningful. I'm hoping that the audience had a clear takeaways, and we see a lot of the Q&A in there. I appreciate each of you sharing not just your professional experience, but you showed your personal experience without me even having to ask, because you wanted to make an impact for those that are listening to this and watching this later. So I personally want to thank you for coming on, being yourself, and obviously each of your stature. You didn't have to be here, but you wanted to be here. So I thank each and every one of you.
Thanks,
Thank you, Ryan.
And to the audience, my final message, this is obviously Mental Health Awareness Month, but this is not where it stops. This is not just 1 month of just talking about it. It's being aware, listening, and to sum up, which, I wrote down a whole bunch of notes, but you do have to be prepared. We don't know everything, and understand from different types of people. And being kind will go a long way. And again, I don't want to make this as a monologue, but I think I want to represent everyone who was talking to here, that we are in a space that is not easy, and and there's nothing to sugarcoat that, and no one is. But what the future is really bright, and innovation is going to continue to be more. And sometimes just asking a simple question of how you're doing and actually listening can go a long way. And you got all these great resources that I think we shared today. Use them. I don't think I've ever seen this many resources of anything that's free, that is meaningful behind any of this, and that there are people willing to talk about it. So to the audience, I appreciate you. We appreciate you. The questions, I'm sorry we couldn't get to all of them, but I think we did our best to get to as many as we can. And we do appreciate you all, and wishing you all the best, and have a great rest of the day wherever you're watching this. Thank you all.
Thank you to everyone that joined us today. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, October 8th through 11th for Health 2023.